Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a double-boarded cosmetic facial surgeon in Richmond, Virginia. I'm usually posting about facelifts and eyelids, but we're going to post a little thing today on filler rejuvenation of earlobes. I hope you enjoy the video. Today we're going to do a little bit of earlobe rejuvenation, and males and females, as we age, we just lose volume in our earlobes and they become thin and get lines or wrinkles in them. And it's a very underlooked region for filler treatment. It's actually, you can do a lot for people. Sometimes we'll put a permanent filler like silicone in here, but it's great to do a test drive first to make sure people like what you're doing. And in this case, we are using Juvederm Velour, and we're going to use a syringe in each side. And I'm using an injection, fat injection gun device here. And so we're going to just kind of get in the middle of the lobe and plump. And you can watch it in front of your eyes plump up. Now, if patients have a piercing, which seems most females do, you want to inject on either side of it, and you want to make sure that you're dispersing your filler, because if you don't, it's going to make a donut where that piercing is, if that makes sense. And sometimes it can take an awful lot of filler to do this. In this case, she's inflating very well here, and I think we'll get a syringe in each side. And you have to remember, with these new fillers, it's what you see is what you get, which in the early days of fillers, you had to overcorrect. Now I'm going to go through the hole up into the anterior part, and you can see that filling. And then also here, the inferior border of the lobe, which I'm blocking your view, but I want to explain something. I am palpating and feeling that filler go into the lobe, so that obviously when you're doing a video, that's not necessarily helpful. Then I see one little dot right here that could use a little bit, and I think right there is a pretty good correction, and we'll give it a couple minutes, and before she leaves, see if we need to put a little bit more. You can also put a little bit right here and massage that. And we'll go back and do the other side. And now we'll approach the other side so you can see where she's deficient here. So obviously those are areas that we want to fill first. And this time I'm going to start at the superior part going through the piercing hole. And we usually just do this with a regular syringe or this. I really like this little fat injection gun. To me, I think it's very, very accurate. You can put extremely small aliquots in, and it doesn't fatigue your thumbs if you do a lot of fillers. And so looking at that, you can see that it's doing well here. Now I'm under the hole there, inferior to that, and get a little bit behind it. And I like to compress it. And this patient just has topical BLT type anesthesia. Now, if you are donutting at the injection hole, you can actually just get down and put a little bit there in the border to plump that up. But you also, after it settles in, it seems to do just fine. And like the other side, I'm going to go up right here and just put a little bit at the junction where the lobe meets the helical rim. And let's take, my assistants always have a little bit of Vaseline on their back of their hand, so I can grab that and massage.
And I think that's going to be a very nice initial treatment. We can repeat it if the patient wants, and that's how we do hyaluronic acid filler to rejuvenate earlobes. I'm Dr. Joe Niamtu. LoveThatFace.com.